I'm frequently asked what to do about a crying employee, and although there's some humor involved with maybe how to deal with that, because so many of you are challenged with that kind of employee, there's really an underlying message that's a little more serious than all that. And so forgive the description, but there are some definitive things to look out for when you have an employee who's having an emotion, which is one thing, and an employee who has emotional outbursts, which is entirely another thing. And I think it's also important we work in a feeling environment. So you can't get good people if they don't have at least the propensity to be a bit emotional, for lack of a better term. I, as a male, say emotional. It causes a frightening response in other males. Females hear emotional and they think that that's possibly a good thing. The truth is it's very good for veterinary medicine, but managing emotions is the hard part. So it is normal to have a feeling and to express that. What's not normal is to not be able to understand what the difference is between appropriate sharing of feelings and inappropriate sharing of feelings. In other words, when you get the sense that the employee at whatever level is not controlling the velocity of their response, the intensity of their response, that they seem to be just reacting, then we know they're having a typical meltdown. For women, it can oftentimes come in the form of crying, but not always. For men, it sometimes comes in the form of crying, but almost always it's some sort of internal something's going to happen that makes them freak out. And that's what it'll feel like. It'll feel like a shriek, like you've hit a wall of, uh-oh, we crossed a line from which we can't return. And so the first thing to remember is who they are and what they think about you and what they're doing is none of your business, because truly it's not about you. And if you as a manager can't handle somebody else's emotional response, whatever the severity of it is, then there's some boundary issues. Because it's really, they're not your family, they're not your lover, they're not your brother, they're not your mother, they're somebody that you work with. And so my job is to have boundaries with them as a person, and secondarily to help them model what good behavior is. So when employees cry and it's not appropriate, and let me tell you when it's not appropriate. When I confront you about a policy, it's not appropriate to cry. When I confront you about how you're dressed, it's not appropriate to cry. When a client tells you that they're unhappy with the service, it's not appropriate to cry. The only time it's appropriate to cry is if I physically or verbally, or someone physically or verbally attacks you. That's probably an appropriate response. And in sadness, that's an appropriate response. However, being an employee who cries when addressed in a normal and professional fashion is really a warning sign that that person isn't fit for the workplace. Normal people don't freak out when they get confronted. And so your job, if you're a healthy manager, is to talk to the employee about what you're doing right now is not acceptable. I'm not talking to you until you stop crying. And I will literally look at an employee and say, stop crying. I need you to stop now. Pull it together and we can have this conversation. So you can leave for 5 minutes or I'll leave for 10 minutes, and when I come back, we'll try again. And if the employee is still that kind of crying that you know happens, I respectfully invite them to go home for the day. That really they're just too upset to work, and that's okay. But you can't regularly be too upset to work. So the next response, if it's a good employee, becomes about hopefully the employee saying, how do I control my emotions? If they're really good, they'll say, I don't want to be like this. I want to be more professional. And that's an inside job. That's where your job stops and a professional's job begins. It's good for the employee to ask, but that's when you say there's outside help. There's a counselor, there's therapy, but the dysfunctional part is yours to manage. You're not responsible for why they act that way. You're responsible for confronting it when it happens.